The role of the first aider. The first aider has got a crucial role. They are the first person to arrive at scene at any incident or accident in the workplace or out and about. The aim of the first aider is the 3 Ps. Their job is to preserve life, not just the casualty but the first aider as well. They're there to prevent the condition from getting worse and also to promote recovery. And they do that by learning the first aid skills you're going to be learning throughout this course. Now before we move on, we need to know who's who. So when I refer to a baby, I mean anybody from birth to 1 year old. A child is from 1 to puberty, and an adult is from puberty onwards. Now, as a first aider, you need to know what to do when you arrive at a scene, because there's so many responsibilities that you are responsible for. When you arrive at a scene, you've got to assess the situation. You've got to make sure the area is safe before you go and put yourself into danger. I've got to go back to the 3 Ps. Prevent a situation from getting worse. Shout for help so you've got someone there to help you. Make sure you get a first aid kit. And also ask questions. It is so important to speak to the casualty, but also the witnesses around. Now it's crucial you speak to those witnesses, because the casualty might say, "I'm fine, I just fell down and banged my head." But the witnesses might say, "Well, they've just had an epileptic seizure and they've been unconscious for 10 minutes. And your job as a first aider is to gather all that information, so if you need to, you can pass it on to the medical services if they are required. Now the next step is actually hands-on dealing with the casualties. The first thing you've got to do is, if there's any bodily fluids around, is protect yourself with some gloves, ideally the latex-free gloves from your first aid kit. You then check to see if they're conscious, i.e. if they respond to you. Then you look for normal breathing. And then you assess any other injuries and illnesses. And of course, if you find they're not breathing at any point or you find a bleed, you then treat them in order of priority. And that order of priority is you always go to the quiet ones first, people that are not breathing, then people that are bleeding, and then you deal with any broken bones. Now, depending on the state of the casualty, you need to call the emergency services. So if it is something serious, like they're not breathing, they have breathing difficulties, they are losing lots of blood, or maybe they've broken quite one of the major bones in the body, you would call 999 or 112. Those are for ones that are an emergency situation. If it's not an emergency, you can call 111, and that will be answered by medical staff who will go through a series of questions with you. And if they deem it to be an emergency, they will send an ambulance out to you. And if they deem it not to be an emergency, they might just give you advice, such as go to the pharmacy, or they might say you need to take them to the doctors. Now, I use this word to help me remember what to say if I'm calling the emergency services. The word is Lionel. You make sure you tell them where their location is. You must know the postcode of where you are. You must tell them the incident that's happened, because that will determine how quickly the emergency services will get to you. If it's a breathing difficulty or chest pain, they will get there as quick as they possibly can. O stands for any other services, such as the police or the fire brigade. The number of casualties will depend on how many trucks they send to you, i.e. how many ambulances they send out to you. And finally, repeat the location again. And you need to know the postcode and the name of the road where you live. And try and be really clear with your instructions, especially if you have a name of a house on a road. Sometimes it's very difficult to find. So try and be clear with your instructions. And finally, throughout all this, try and stay calm and confident. It will help you, it will help the patient, and it will reassure the people around who are trying to assist and help as well. Okay, so now the ambulance has now arrived, you're thinking, job done, that's me finished. No, there's lots of things you have to do, and actually legal requirements that you would have to do as well. First thing will be your handover to the medical services. You must tell them the condition of the casualty now, the history, any assessment, and the treatment that you were given. It's also your legal responsibility to contact the next of kin of those children they've been looking after. So you must contact the next of kin. You must also fill out an action report form and contact your authorities, making sure Ofsted are aware about it as well. You need to dispose of any dressings that you've used, so any bloods or any fluids, need to make sure you clean them up and anything you've used from the first aid kit, you must make sure you restock it again. Now, if you do dispose of dressings, they should ideally go into a yellow bag, into a yellow bin. But you might not have one of those if you're maybe a childminder in the home. Hopefully you would have if you're a nursery worker, but you could put them in things like the nappy bin, the sanitary bin in the ladies' toilets, or you can just bag them all up and give them to the paramedics. Finally, you need to be aware of your own feelings. You might cope perfectly fine in giving that emergency first aid treatment, and it might be later that night that you suddenly feel, actually, I need to talk to somebody.